G'day, how's going?
When it comes to injuries like tennis and golfer's elbow, otherwise known as lateral and medial epicondylitis, it's really important that you ask some key questions in the history taking, because this is where you're most likely to uncover how these injuries came about. So the first thing to understand with tennis and golfer's elbow is that these are your classic repetitive strain injuries. These are injuries where through doing some sort of repetitive task like hitting a tennis ball, a golf ball, maybe a handyman doing lots of work with screwdrivers, a plumber doing lots of screwing and unscrewing of pipes and caps and things like that, jackhammering, any repetitive task can result in irritation at either the outside or the inside of the elbow. So in the case of a tennis player, which is where my background is, there are three key things that you want to ask in the history. It's really, really important that you start with their equipment. You might be very skilled as a practitioner in helping somebody beat the symptoms that they're feeling, but as soon as they go back out onto the court and play, they'll struggle with these injuries again. The three key pieces of information that you need about their equipment is 1, the weight of their racket, 2, the grip size, and 3, the strings. And with the strings, we're going to talk about the type of string and also the string tension. So why is mass of your racket important? It's important because when your racket strikes the tennis ball, understand that that is a collision, and we want the arm to feel as comfortable as possible during that collision. So typically I will use a racket that is around about 350 grams, and most semi-pro club players, professional players will play with a racket that's anywhere from about 300 to as much as 380 grams. 380 grams is far above what most people will use. I think the sweet spot would be around 315 to 340 grams. A question I like to ask people is, if I was to give you a cricket bat and a table tennis paddle, which one do you think would be easier to hit a tennis ball over the net if I was to feed it to you underhand from one side of the net? The cricket bat should be much easier because it has more mass. It has huge mass. It's probably anywhere from 1 to 2 kilos. And if you could manage to just sort of swing it like a pendulum and connect the ball, it would quite easily travel to the back fence. Whereas a table tennis paddle, you'd really have to wind up your backswing and take a full cut at the ball in order to propel that ball over. And try to have a think about where you would feel the shock of that collision. With the cricket bat, carrying such mass, it would be very deadened through your arm, as opposed to using a table tennis paddle where you would feel every vibration going through your arm. So hopefully you can see in this example how mass is a critical component of your racket setup to get correct. Now, if you have a racket that's far too heavy, that's going to be taxing on your arm because you won't have the muscular effort to be able to swing that racket head through the arc of the swing without straining muscles. If it's too light, you'll have no problem swinging it through and increasing racket head speed, but because of its low mass, you're going to feel it in your arm. So there's going to be a sweet spot of weight, and there introduces another issue, and that is, depending on your age and the level of player you are, you need to get your weight right. So personally, having played at a pretty high level in the past, my racket's about 350 grams, and I'm 6'2", about 90 kilos, so I have no problem swinging that, and I don't have elbow issues. Somebody who is a more junior player would naturally go to a lower mass racket, but then again, if they're quite advanced, they might be able to afford an increase in weight. So when it comes to the history taken, you're dealing with a tennis player specifically, you need to understand these parts of their game and the level at which they're at to determine whether the mass of their racket is a factor in their elbow pain. The next part of the racket setup is the grip size. So I use about a 4 3/8 grip size. Sometimes I'll use a 4 1/4, but I'll beef it up with some over grips. A question I like to ask people is, if you were going to do a chin-up, would you prefer to do a chin-up with a bar that's about that thick, one that you can wrap your fingers around nicely, or one that's more like the branch of a tree, which is really fat? And you should be answering you'd much prefer to get one where you can wrap your fingers around, because if you can fully grip that bar, you'll have more access to strength. And this is why you'll see in some gyms, sometimes the dumbbells will have fat grips, because it's harder. It's more work on your forearms to try and maneuver a barbell or a dumbbell versus something that's much thinner. And if it's too thin, it will rip into your hands. And with respect to a tennis racket, if the grip was 3 1/4, something ridiculous like that, you wouldn't be able to appropriately maneuver your grip around the racket, and it would feel far too head heavy. If it's too thick, what usually happens is that people tend to strain because they're trying to strike the ball the way they would normally, but they're straining because they're having to grip the racket grip with more force during the impact of the collision. So grip size should not be difficult to get right. The old school way of finding out whether a grip is right for you or not is to hold the racket like that, and if you can get a finger in through there, that's the right grip. If it's too fat and there's too much distance, it's too big. This one is 4 3/8. I actually feel comfortable with this one, so for me that's fine, and it is a personal preference, but again, it's something you need to quiz your patient about if they're suffering golfer's or tennis elbow from playing tennis. Then finally, the type of string is really important. So you can get really synthetic poly type strings, and if you run your nail across them as if trying to pick apart the string, you can't, because it's too hard. So naturally this string will have quite a more harsh impact as you strike the ball, but you can compensate for that by lowering the string tension, which is what I did during my time playing. So I would play with a hard string, if we want to call it that, but I would play at about 50 pounds, sometimes as low as 48 pounds, which is quite loose. Alternatively, you can play with a high tension, and when you string your racket strings really, really tight, there's less of a trampoline effect. So imagine the ball colliding with the racket and sinking into the string bed. It will do that with every string bed, but the degree to which is determined by the string tension. So in a racket that's strung with 50 pounds, it will have quite a noticeable trampoline effect as opposed to something that's strung with 60 pounds. And when it comes to tennis, you can't have something that's too tight and you can't have something that's too loose, because too tight it could break the racket itself, and too loose you'll just lose so much control. And imagine if it was just strung hand tight, the ball would just fall straight through the string bed. So in players who are suffering elbow pain, you want to make sure that their racket isn't strung too tight, particularly not too tight with a very strong string type. If somebody is suffering really sensitive elbow pain, I usually advise them to lower the tension significantly by 2, maybe 3 kilos, and also consider using a multi-filament string. So you can get these strings where if you do the fingernail test, if you like, it's a very soft texture, almost such that you could pick your way through the string and snap it that way. So strings like Gut, Technifiber Biphase, as opposed to probably one of the toughest, most terrible strings I've ever used is Babolat Hurricane. It's either Babolat Hurricane, Pro Hurricane. Babolat Pro Hurricane Tour was a good string. This one right here is Technifiber Black Code. They're all pretty much the same, but if you get somebody who's using Hurricane, that's pretty scary. They're hardcore if they're using that. So remember those 3 aspects: the mass, the grip size, and the string, both the type of the string and the tension. They're 3 key aspects of a tennis player's racket setup that you want to inquire about before you go on to do all of your testing and ask further questions like where exactly the pain is, and how long have you had it, what's the character of the pain, etc. But if you're not a tennis player, then you have to think a little bit more outside the box. Like if they are a handyman, trying to get a feel for what are the type of activities that they do regularly or recently that has brought them to you in that state. So you might be asking, well, how is it that a tennis player can get golfer's elbow? So golfer's elbow, I think, was because when you take a swing at a golf ball, as you're, in my case, as a right-handed golfer, my right arm at the medial epicondyle as it strikes the ball, if I strike it poorly, the tension on the common flexor origin can result in medial epicondylitis. In the old school days when people would play tennis like so, they might develop lateral elbow pain, and it would ultimately turn into tennis elbow. That's still the case. Very unlikely in a double-handed backhand. But when you come to the forehand, if you can see my elbow here, as I take the racket back, lay my wrist back, and then bring it forward to make impact with the ball, as that ball collides with the string bed, it will forcibly extend my wrist, thereby tugging on the common flexor origin. Hence we can develop golfer's elbow. And in the modern game with such whippiness through the forehand, that's how we can develop golfer's elbow as tennis players. So what are the exercises that we can do? Let's say you've gone to see somebody, you've gotten some good treatment, and now you go home. What do you do now? So there's really only one exercise that I know of that is really beneficial specifically for the elbow, and that is eccentric loading of either the forearm flexors or the forearm extensors, depending on whether you're suffering tennis or golfer's elbow. So imagine for a moment that this racket I have here is actually a club bell. If you don't know what a club bell is, it basically looks like a nightstick where one end is one size and the other end fattens. It might have a bell on it, or it might just widen so that you have an off-centered weight. You can search for them online. As I said, they're called club bells. They start from 2 kilos, they go right up to 20 kilos. But usually for a tennis player, you probably want one that's around 3 to 4 kilos. And maybe for somebody who's more amateur or say a more frail sort of individual, like an elderly person who's playing tennis, they might get away with a 1 or a 2 kilo dumbbell. But this is how it would look. We'll do the tennis elbow one first. So you will hold your arm at full extension, and you'll hold the club bell in your hand, okay? And hold it down the bottom because you want to increase the lever length. And then what you do here is you're going to slowly drop the racket down as if you're holding your wrist out or your hand out to be kissed by a prince, that sort of thing. And that analogy is a good one because a lot of people, they start doing this. They internally rotate at the shoulder and there's no movement at the wrist. That does nothing for your extensor tendons. You have to break at the wrist. So you let that racket or that club bell drop down, and as I do that, I feel tension along the back side of my forearm. Not a lot though, because as I said, this racket's only about 350 grams. Really, for it to be effective, it needs to be much heavier. And you want to do 3 sets of 15 reps of this. This is eccentric loading of the extensor tendons. This is what you would do for tennis elbow pain, okay? And then you would help it back up and drop it down. Don't bring it back up like this. That's the concentric phase where you're contracting. It's in somebody who's suffering tennis elbow pain, it's too stressful on the injured tendon. You want to rest it from that. So lowering it down fairly slowly, help it back up, and you've got to do 15 of those. It's boring as, but it will help. This is the best available research we have on this. Now, to do golfer's elbow, or rather eccentric loading of the common flexor tendons, you're going to do the same thing. You're going to start holding the club bell up towards the bottom of the handle. Now you're going to drop it the other way. Now in my right hand, I'm dropping it away from me and slightly to the right side. If I was a lefty, I'd drop it out this way, okay? The idea is that you're going to feel tension on the inside of the elbow. So if I show you from this aspect, I'm dropping it down and slightly to the right. I will have a little bit of external rotation of the shoulder, but so long as I get supination of the forearm or a turning out, that's what we want. And again, you would do 3 sets of 15 repetitions for this exercise. Thanks for watching. Please subscribe to my YouTube channel Yeah, thanks, mate. Good on you.